UW Health's Chief Quality Officer, Dr. Jeff Pothof, is back with us for his weekly visit. Good to see you again.
Dr. Pothof, good to see you.
Good to be here.
How big of a deal is this?
You know, for some people, this is a really big deal. I know families who have these young children who are doing the things that we kind of forgot about. They're wearing masks, they're avoiding large groups, they're postponing vacations. Now that they're able to get their children vaccinated, they are afforded those same protections. Their life can get more back to normal like the rest of us.
How do you decide if the Moderna vaccine, the 2-dose, or the Pfizer 3-dose vaccine is better for your child?
You know, I think for the most part, they're going to be about equivalent. If you look at efficacy data, Pfizer has the 3-shot series. At 3 shots, you're going to have about 80% protection from any symptoms at all initially. That'll wane over time, but you're still going to have great protection against severe disease. Moderna's less than that at a 2-dose series, but I think what will happen is at some point in the future, like most of these vaccines, there will be a booster dose added on, making Moderna a 3-dose series, which will likely have equivalent protection. So right now, I think it's a horse apiece. Whichever one you can find that's convenient, I'd go out and get it.
The CDC says 70% of children in the U.S. have gotten COVID. So I'm a parent. Why get a shot? They've had it already.
Yeah, I think, you know, a lot of parents are wondering, you know, should I sign my kid up? I know after that second dose, they're going to be fussy. Maybe they'll have a fever. And what we say to that is that the vaccine provides really good protection against more severe disease. And with the variants that are out there, that natural immunity, it could wane. It might not be there for you when you need it. You know, likewise, the vaccine protects against other things that aren't death. I think we so often think it's death or nothing. So things like long haul symptoms, confusion, inability to play in sports this summer or have a good time at a pool, you kind of take that off the table. And you know, I've been there in the room with parents who have a deathly ill child in the PICU. That is absolutely terrifying. So even if it's really, really unlikely that your kid is that kid, you don't want to be that family who finds out that they're in that situation when it could have been prevented by just getting a vaccine. For, you know, really severe disease in kids, there should be almost no tolerance for sick kids with COVID.
Is the vaccine available locally now?
There are places locally that have it. I think what you'll see is over the course of this week, it'll be easier to find. The first vaccinators will be those national vaccinators. They get their supply directly.
Walgreens, CVS.
Yep. State vaccinators, UW Health, most of the clinics, they are going to get their supply from the state probably in the next 24, 48 hours. So by the middle of the week, end of the week, it should be fairly easy to find this dose for your kid.
And get it.
Yeah, I think really no reason not to get it. I think everyone should be getting this unless there's some sort of extraneous circumstance that their doctor is recommending them not.
The death toll right now is about 250 people a day across the country. It's the lowest it's ever been since this all started. It's still 250 people, but it seems we're making some progress.
Yeah, I feel like we're getting closer and closer to that real endemic stage where we're seeing COVID cases. People are coming down with it. It's becoming more of an inconvenience. You know, you don't feel great, but you're not ending up in the hospital. You're not dying. That really does paint a roadmap for how we live with COVID in the future. We get our vaccines, we get our boosters, but life goes on, and it isn't as disruptive as what we saw the last couple years.
We're talking a lot about kids, and we have your family here
We
today.
have some special guests in the studio.
Do the introductions.
Hey, so I've got my family here. This is Kristen, my amazing wife, and I've got my 2 kids, Natalie and Nora, and they were around the studio today, so they stopped in and said
12 and 8?
No. 11 and oh, no, I'm gonna
Okay, Dad.
Yeah. Got me there.
Well, thanks for coming out today.
Nice to see you guys.
And everybody's
You're on
vaccinated,
TV.
obviously.
How cool
And
was that?
Well, have a great summer.
Thank you.
All right, we'll see you next week.